up, everybody? Welcome back to the Move Better channel. Today we have a sensitive topic for a lot of people, and we have a lot of patients that come in asking for relief when it comes to migraines. Now, migraines are a very sensitive subject for a lot of people just because there is just so many aspects that could be involved with a migraine. Now, from the way we're going to be checking it, we're going to be talking about it from a biomechanical standpoint. So today we want to help out by giving you some exercises that may be able to help. Remember, migraines are an inflammatory dysfunction, and it could be that we are not receiving enough oxygen to the brain or enough blood flow through the body. So that's one of the reasons why we might be suffering from a migraine. So Professor John over here is going to be able to lead us through some of those exercises.
So the following exercises we learned from Egoscue, so we want to give them a nice little shout out. And the first one is called a standing overhead stretch. Dr. Joe's gonna stand here in a nice relaxed motion right here. He's gonna interlace his fingers in front of him, and he's gonna go ahead and put it out in front of you like so. And he's gonna look at it, and he's gonna rotate and flex his shoulder all the way up so that his hands go above his head and his arms are aligned to his ear. He's gonna continue to look at that palm and now take the palm and face it upward, okay? From here, try not to overarch. You want to have just a nice natural arching back, okay? And try to relax the whole body and focus on belly breathing, okay? Inhale through your nose, let the belly inflate, and then slowly exhale out. Hold it right here, okay? We're going to actually hold this here for a good amount of time, maybe 30 seconds to 60, okay, depending on what feels good for you at this point. But you should feel a nice stretch from the back, the sides, and also trying to relieve any kind of tension for the body with your belly breathing, okay? How's that feeling?
It's getting tired. But
Getting tired? So maybe 30 seconds for Dr. Joe. And once he's done, go ahead and relax and bring it down nice and slow. Okay? Because a lot of times from a biomechanical perspective, the tension might be coming from the backside right here, and it goes over his head. Okay? So this exercise right here will help hopefully relieve some of that tension. That's exercise.
And allow some oxygen as well.
Yes. The oxygen, we're talking about how bringing some oxygen in and doing some belly breathing and using that to stimulate the nervous system to relax. So the second exercise here is called a seated shoulder arm rotations. We're going to have Dr. Joe sit at the halfway off the chair. Try to get his ankle, knees, and hip at 90 degrees, like so. He's going to try to roll his pelvis forward, okay, the other way. There you go, so that he has a natural lower back arch, okay, and you want to keep that lower back arch throughout the whole time, all right? He's going to take his hand. There's this thing that they call golfer's grip, where you flex the 8 digits and then extend your thumb out, okay? Now you're going to go ahead and we're going to do the shoulder rotation. So you're going to extend his arm out like so with his palms down first, bringing his shoulders down the whole time, squeezing the shoulder blades a little bit together, like so, okay, and keeping that natural arch again. Lower back is nice and curved, and he's gonna just do like 6-inch circles forward. There you go. Hey, Queen, does that look good? So Dr. Joe is doing 6-inch circles forward. We got about 20 repetitions. Once he's done with 20, he's gonna stop. He's gonna flip his palms up, and now he's gonna go backwards with a 20 rotation on his shoulders. And again, keeping the shoulder blades pinned to the back, shoulders away from the ears, keeping the natural curvature here by making sure your hip is rolled forward, okay? And same thing, when you're doing this exercise, breathe through the belly. Breathe through the belly, okay? Inflate the belly, exhale, relax. The only tension you would feel is the shoulders, not anything else, okay? Perfect, good job. The third exercise that we're going to do is called a counter stretch, okay? So what we have here is we're modeling like a table or some kind of counter. Depending on your flexibility, if you're not that flexible in the back side of your body, your lower back, or even your shoulders, this can be a little bit higher as well. But if you're fairly flexible, this can be like waist height or even a little lower, okay? What Dr. Joe is going to do is he's going to have his feet about hip width apart. He's going to put his hands on the counter here, and he's going to back his feet out until most of his weight is on the balls of his feet. He's going to hinge forward, create his lower back arch by rotating the pelvis forward, okay? Perfect. And hinge forward a little bit. Now, here's where the kicker starts. He's gonna extend his knee more so that his quads are contracting, keeping that lower back arch. And now he's gonna slightly drive his chest towards the floor. Boom. And as he's doing that, he's gonna feel a little bit of a pull back here, pulling your pelvis backwards a little bit, feeling a stretch in the chest and the lat area. And he might even feel stretching in his forearms. Okay, and while you're here, contract the quads. There you go. And continue to breathe. And same thing, you gotta use the breathing for the muscle tissues to help relax, okay? You wanna hold this for at least 1 minute. And when 1 minute is done, slowly rise up. Make sure you don't get lightheaded. Carry yourself up. How's that feel?
Looks good.
Pretty good, right?
Nice little stretch, yeah.
Yeah.
All right, so Professor John led us through some exercises that may be able to help some of your migraines. Now remember, you guys, I want you guys to check professional help if you guys are suffering from migraines. These exercises may just help you because we're increasing the amount of oxygen that is needed for the body to decrease inflammation, help the body to relax a little bit, and bring more oxygen to the brain that may just be able to help some of those migraine symptoms that you may be suffering from. Couple of things that I would highly recommend is eyes are very sensitive to light during this time. Try to limit the amount of light being entered into your eyes by staying off of some of your devices that you might be even watching this on. So be careful with the amount of light entering into your eyes. Try to get into a darker room. Let your body try to decompress. Do some light stretching, such as these exercises that Professor John was able to lead us through today. Thanks again, you guys. If you guys like what we're doing here, like, subscribe, comment below. Till the next video.